we'll go ahead and get started. Welcome everyone to our final Black Maternal Health Week webinar. My name is April Wright, and I am one of the outreach and education librarians for Region 1 at the NNLM. Before we get started, there are just a few things that you'll need to know. First of all, captioning is available. You should see it on your screen. You should see it happening on your screen right now. And all attendees have been muted, but we welcome your questions in the chat, and please be sure to direct any questions and comments to everyone when you put them in the chat. There will be time at the end of the webinar for questions. We are recording today's session, and it will be available in various places, including the accompanying, including the guide, the Maternal Health Week guide, and I'll put that in the chat in a little bit. As a reminder, registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct, and it's a reminder that we are all together professionally, and we want to be inclusive and respectful. So your cooperation is appreciated. And the code of conduct, I can stick that in the chat as well. This class is eligible for 1.5 one MLA CE, and it is also available for chess credit, for one chess credit. And please, fill out the evaluation so that you will be able to get credit for the session. And even if you don't want credit for the session, please fill out the evaluations because we'd love to get your feedback. First of all, let me tell you a little bit about us. I know some of you are probably already familiar with us, but those who aren't, let me just share a little bit about who we are. The National Institutes of Health is the nation's leading medical research agency. And many of you might be familiar with the National Cancer Institute, which is one of the many institutes and centers of NIH. NLM, or the National Library of Medicine, is one of 27 institutes and offices of the NIH. And it's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. And NLM, the network of the National Library of Medicine, is an outreach program of the NLM, working to ensure health professionals and the public have equal access to health information. NLM is made up of 7 regional medical libraries, 3 national offices, 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 member organizations. And this is a map of our 7 regions. And if you would like to find out more about NNLM, you can go to nnlm.gov. Now let me introduce you now to our guest presenter, Buan Foster. Buan Foster is the president and CEO of Life After 2 Losses. She received her Bachelor's of Science degree in Public Health from William Patterson University and Master of Public Health concentrating in Health Systems Administration and Policy from Montclair State University. She serves as Vice Chair of the New Jersey Maternal Care Quality Collaborative, and is certified in preconception peer education, mental health first aid, and nonprofit management. She began Life After 2 Losses after the tragic loss of 2 of her babies through 2 pregnancies. Life After 2 Losses is a nonprofit organization with the mission to prevent reproductive and health injustices through the support and empowerment of women and families in the community. Now, the organization received a grant from Region 1, NNLM Region 1, to continue their mission of 1, changing the narrative around pregnancy loss, 2, education and raising awareness, and 3, advocacy efforts, and 4, grief support. This presentation will discuss their grant project to create educational programs to support Black, Indigenous, and people of color women in birthing people on birth justice and health equity issues. Please join me in welcoming Luann Foster, and I am going to stop sharing.
Thank you so much. So hi, everyone. I'm excited to be here with you all. Thank you so much for signing on. So today we're going to be discussing life after two losses, support advocacy, and health literacy for a healthy pregnancy. Okay, so April did an amazing job of giving my introduction. As she mentioned, I went to William Patterson in Montclair State, and that is where I received my educational background. This work has become very personal to me after I suffered two preventable pregnancy losses, and largely they were due to systematic racism and implicit bias. And from that work, I wanted to do something so that the things that happened to me wouldn't happen to any other family. This is why I started my work with Life After Two Losses. So prior to founding Life After Two Losses, I tried to transition from healthcare administration into the maternal child health space, but I kept receiving rejection letter after rejection letter. I was told that I did not have enough experience in maternal child health and I should go get more experience. So I decided to make my own seat at the table, and that is when I founded my organization, Life After Two Losses. And originally it started because I saw that there was a need. After, again, experiencing two losses, I was suffering greatly with anxiety and depression behind the losses. So the grief support that was provided in New Jersey, I felt like really only fueled the anxiety and depression, but there was no way out. And I noticed that this wasn't just the case for me. I noticed other women were saying the same things. And in these spaces, they were mostly dominated by white women. It wasn't a space where, Black women felt included. And I decided to do that. And with our organization, what we did was we spent a small amount of time on reliving our experiences, and the remainder of the time spent on tools and tips on how to get your life back to a healthy place. It's something that has helped me and as well as helped the participants in our grief support. So those participants who utilized our grief support reported discrimination and a need for health literacy focused on empowerment. And that is why we decided to pilot this program that NNMLA funded. So before we get started, I just want to talk about the objectives that we will be covering here today. So first, we're going to identify birth justice and health equity literacy needs of medical and at-risk and underserved BIPOC persons. We're going to explain the methods this program used to prepare BIPOC persons to make well-informed decisions about and advocate for quality birthing and maternal care. Lastly, we're going to discuss the outcomes of this project. So I'm not sure if you're aware, but we are currently in a maternal health crisis in the United States. Maternal mortality rates are at record levels, and New Jersey has one of the widest racial disparity gap for maternal and infant mortality. So April 11th through the 17th is Black Maternal Health Week. And we know that Black women in the United States experience significantly worse maternal health outcomes compared to their white counterparts. According to the Center for Disease Control and Prevention, Black women are roughly 3 times more likely to die from a pregnancy-related complication than white women. So as you all can probably see in my banner, I did have a healthy baby boy, and his name is King Cairo. But shortly after having my son, I just started experiencing a number of health symptoms, and I knew that something wasn't right. So again, upon leaving the hospital, I expressed all the symptoms that I was feeling, and I kept saying, I think I need to be further evaluated. Something is not right. And I was discharged and told, this is normal. You had a C-section, you had a baby, you're fine, go home. 3 days later, I went to my medical care providers and I said, I'm still experiencing these same symptoms. I really don't feel like something is right. I really think you guys need to, listen to me. So I was told, you know what, in a week, if you're still having these symptoms, come back. 3 days later, while I was home, I said to my family, like, we need to go to the hospital now because I felt like I was dying. So when I got to the hospital, I emphasized that I had severe swelling in my limbs. I also emphasized that I had blurred vision and I had this ringing in my ear that had not gone away and it was only getting worse. The nurse, I also told her, I said, this is about the third time that I've come to the healthcare facility and no one's listening to me. With the work that I do in New Jersey, I know that Black women and Black babies are dying because no one's listening. And she listened and she had the doctor perform the necessary tests and they found that I had protein in my urine. I also found out that I had 30 pounds of fluid that was backing into my lungs. My blood pressures were hypertensive crisis. I was so bad that I had to be transferred with the team administering drugs to save my life en route to a hospital that could better care for my needs. Upon arriving there, again, I was so bad that the hospital staff didn't even want to put me on the elevator. They kept me in the emergency room. They had the pharmacist come down to administer drugs again because things were I was so critical. They said they were minutes away from sending me to the ICU. So as well, Black infants also have a higher rate of premature birth and infant mortalities. And as I mentioned, I had two preventable pregnancy losses. With my first loss, my water broke early and I showed up at the hospital that my doctor was a, participant in. And I basically was told that I had two options to go home and maintain my pregnancy or have an abortion. But what I didn't know, which I now know now, that I was supposed to have received antibiotics so that I would not go into septic shock. I ended up going home and a week later, I went into septic shock. And I only knew this because I went to the local hospital instead of the hospital that was about 40 minutes away because I just wasn't feeling right. And upon, again, going to a facility that I had not been to before, I was stuck 20 times by the attendant physician who delayed life-saving treatment because he wanted a blood sample, because he made an assumption that because I was a young Black girl that I had HIV. I pleaded with them to stop sticking me, to please just call my doctors that I did not have HIV. Also, the nurse whispered into my ear, sweetheart, next time you get pregnant, use protection so you don't get STDs and they don't ruin your pregnancy. Again, another assumption that they made because, again, I'm a young Black girl, I must have STDs, which was not the case. After they realized that my daughter was not going to survive, they sent me to the postpartum floor. And as the nurse was walking out, I said, what's going to happen, when it comes time to deliver my baby, what's going to happen? And she basically said, your baby's going to die. You will deliver your baby by yourself. All of this while I was experiencing septic shock. In my second pregnancy, something similar happened, but instead of my complete water breaking, I had a trickle of water. So I showed up to labor and delivery, again, because this time I was a little bit further along than I was prior. And I said, something is not right. I feel like what's happened last time is happening to me again. And I was checked out, but then I was discharged and dismissed and sent on my way. But when I got into the parking lot, the remainder of my water broke. When I came back inside visibly upset, I said to the nurse, I was telling you that the same thing was happening again, asking you all to put me on bed rest so that I could try to maintain my pregnancy. And her response was, if it happened inside or outside, it was going to happen anyway. I know for a fact that would have not been said to a white woman. I ended up being told that, I was going into septic shock again. So I would need to deliver my daughter. And she was one day away from the NICU cutoff. So the hospital basically let her die in my arms. And had I been at the first hospital, they would have done anything to save her. But again, that experience was so bad, I would have not went back to that hospital. So Black Maternal Health Week is to raise awareness of these disparities, highlighting the urgent need for equitable and accessible maternal health care. So birth equity. It's important to discuss these before we move on with the presentation. But birth equity refers to the goal of ensuring that all individuals have equal access to safe, respectable maternity care, regardless of their race, ethnicity, socioeconomic status, or other factors. It emphasizes eliminating disparities in maternal health outcomes and addressing the root cause of these disparities. Birth equity aims to provide fair and just opportunities for all pregnant individuals. So reproductive justice. Reproductive justice is a broad framework that goes beyond reproductive rights and focus on the intersectionality of a various of issues affecting marginalized communities. It advocates for the right of individuals to make their own decisions about reproductive health, including the right to have or not have a child, and the right to parent their children in safe and supportive environments. So reproductive justice also addresses the impact of systematic inequalities such as racism, poverty, and discrimination on reproductive health outcomes and advocacy for social and economic justice. So when I share my story, something that people don't know is that I wasn't given all the options. I have a condition called incompetent cervix diagnosis, and the procedure that I did end up receiving in my second pregnancy, which is a transabdominal cerclage, I wasn't told that that was an 85% chance that I would get to 24 weeks. And we know that the survival rate for a 24-weeker versus a full-term baby is a lot slimmer than that. So I now have a procedure which has brought my son into the world. I have a abdominal cerclage, which is permanently. I will never deliver a baby vaginally again. But again, I wasn't given all the options with my condition. I was told, oh, if it happens again, then we can do this. Instead of being proactive and providing me with solutions that again would prevent multiple pregnancy losses. And that women typically with my condition do not know that they have an incompetent cervix unless they've had multiple losses. And it's really unfortunate because there is a procedure which is called, it's a transvaginal ultrasound where they can basically check your cervical length, but it's been deemed that because every woman doesn't have this condition, it's too costly. So again, you wouldn't know you had this condition unless you've had multiple pregnancy losses. Okay, so more about my partnership with NNLM. So we received funding for a pilot health literacy program. And my thought process behind this was similar to my situation. I realized that I was very native in my first pregnancy. I showed up expecting the doctors, the hospitals to know everything, and I was just along for the ride. In my second pregnancy, I got a bit more hands-on, but not as hands-on as I should have been. But in my third pregnancy, I realized that I needed to be a partner in my care, and I needed to do my research, and I needed to, be equipped to make informed decisions. And not only the information that the doctors were giving me, but I needed to get second opinions and find out what was the best treatment option and plan for me. And I truly believe that doing that is the reason why my son is here as well as myself. So with this, we want to focus on empowerment, empowering our women, families, and those in the community with shared decision-making during conception, pregnancy, and postpartum. This support has enabled the expansion and reach of life after 2 losses. So again, when we first started, we were just providing grief support, but now we're able to provide health literacy presentations in our communities and in the communities of our partners with this funding. Okay, so a little bit more about the health literacy and advocacy workshops. So the goal was to provide free health literacy and advocacy workshops, reaching 500 pregnant/postpartum mamas, birthing workers, and supportive partners of all genders who are BIPOC or living on low income. The workshops aim to increase health literacy related to common perinatal health issues and enhance self-advocacy skills to navigate healthcare bias and obtain vital care. So prior to this work, I was a patient representative. This was actually my job when I was pregnant with my first daughter. I was a patient representative at a community hospital, and it was my job to basically do intentional rounding on the patients every hour in the emergency room to make sure that they felt okay, like the doctors were listening to them, they understood their treatment plan, if they had any concerns I address those. And I realized that most often than none, sometimes in low income communities, patients are being dismissed. Their concerns are not being addressed. They're not being listened to. And what I wanted to do again with this project was to empower people living in low income. Okay. So the workshop sessions, what we planned for was monthly hour-long workshops will be conducted doing alternating between online and in-person sessions. Some of our partners that we did these presentations with included Newark Housing Authority, which is the largest in New Jersey in regards to low-income residents. Southern New Jersey Perinatal Cooperative, and we partner with other organizations serving pregnant and postpartum mamas with low income. We also, each session, again, we wanted to be equitable and make sure that even if you were not there or in that community that we provided the presentation, we wanted to make sure that you would still have access to the information. So another thing we pitched and what we did was we built a partnership with the city of Newark. And, can everyone? Oh, that's someone else's audio. Sorry, I saw something about connecting audio. I wasn't sure if my audio had went out.
Nope, you're good.
Okay, thank you so much.
Okay.
So the goal was Newark Libraries is the New Jersey's top comprehensive library in New Jersey, serving, I believe it's 300,000 or 200,000 participants. So we'll be putting a kiosk in the library, a public health awareness kiosk, where you can access these trainings that we've done. And they'll also be on our YouTube channel and on our website when the project is complete. So the participants' eligibility and support details. So sessions are obviously open to all, but what we are focusing on is BIPOC, pregnant postpartum individuals, and their support partners, as well as those interested in becoming pregnant. Topics cater to perinatal health issues, common in BIPOC mamas due to systematic racism, tools and resources provided to assist with self-monitoring and self-advocacy. I'm quite sure we all have been watching the news, and we've been seeing a lot of maternal deaths due to like cardiac arrest and postpartum preeclampsia. And as I mentioned, I was diagnosed with severe postpartum preeclampsia. And I was told that had I not come in that last time, I most likely would have had a heart attack or a stroke at home because I, again, was going into critical condition. But again, I kept going into the hospital, refusing to allow them to dismiss me. And thank God I was diagnosed. However, because it took so long for me to be diagnosed, it ended up taking me, I had to be readmitted multiple times because then I would be okay, but then I would go back again. And it took me well over a year to completely get better from. Okay. So here's some of the topics that we thought was most important, and we provided presentations. So November, we did Premature Awareness Month. For December, we did World AIDS Awareness Month, and we talked about how you can prevent the spread of HIV and AIDS to your unborn child. Again, I mentioned cervical health, especially as that's a common issue as well. We talked about diabetes as well as gestational diabetes. We talked about World Prenatal Infection Prevention Month. In March, we talked about National Endometriosis Awareness Month. In April, we did a presentation again at Southern Perinatal in New Jersey, and we talked about stress and the importance of, having support people for you when you're dealing with stressful environments, and what causes are and what are ways that you can alleviate stress. We also talked about Black Maternal Health Week and the importance of learning how to be your own advocate. In May, we talked about preeclampsia awareness. We talked about the warning signs, what you should do if you are experiencing the warning signs, and what the treatment options are. In June, we talked about premature, mature rupture of membranes, which is PROM, is something that I dealt with in both of my first two pregnancies. We also talked about men's health. We thought it was equally important to be able to support partners. In July, we talked about minority mental health. Again, our organization focused on grief support, and it's very important to make sure that you're in a good place mentally. In August, we talked about National Fetal Alcohol Syndrome Disorders Awareness and National Breastfeeding Month. I had many struggles after giving birth to my son with breastfeeding. Again, I was told many different things like, that there was issues with my body and that's why my son was not latching and just give it up, just use formula. And, there was a lot of delays between doing the skin to skin. And then at one point again, because I was not feeling well, but he was also in the NICU and I was trying to go upstairs to make sure that I was developing that bond with him. I was told that, it was best to just let them do their job and just stay downstairs and focus on, getting better, which I believe had an impact on our breastfeeding journey because he had gotten so used to taking it from the bottle that when we were struggling, he was becoming easily frustrated. But I saw a number of lactation consultants and I took from each of them and I was able to get him to latch and I ended up deciding to quit formula cold turkey. And, we were successful in our breastfeeding journey and I ended up being able to breastfeed him until he was 2. So September is Neonatal Intensive Care and Awareness Month, and it's also World Suicide Prevention Day. And lastly would be October Pregnancy and Infant Loss Awareness and Health Literacy. Okay, so here are the change outcomes that we've expected from this presentation. So know when to seek medical advice. So again, with the preeclampsia, if you are having the blurred vision, if you are having the blood pressures, high blood pressures, if you are experiencing these things shortly after, having a baby, we want people to, recognize the warning signs. And not only recognize the warning signs, but if you show up to a hospital or a medical provider and you know that something is not right and that provider is not listening to you, find another one or keep showing up. We want to increase health literacy and we wanted to do it basically on, layman terms so that anybody experiencing our presentations could understand the information. Also, the ability to self-monitor maternal and fetal health. I was an ambassador for Count the Kicks organization. And with that organization, especially in my pregnancy, I brought everybody who was following our journey on with me in regards to kick counting. When you're high risk, you start counting kicks, I believe at 28 weeks versus the 3rd trimester. And I would tell people you want to make sure you do this at the same time. You want to make sure that you're using the app to track fetal movements. And if you notice that there is something wrong, call your provider and at least you have this spreadsheet like, listen, I normally get X amount of kicks in this amount of time, but today I'm only receiving 5 kicks. But at least you have some proof to help you better advocate for yourself and your baby to prevent stillbirth. So we want to increase self-advocacy skills to determine if care is needed due to providers' bias, leading to increase. Sorry. There we go. Leading to increased healthcare access and improved health outcomes. So assessments and measuring. So one of the things we did was we wanted to collect the participants' demographics. So we asked them their name, their email addresses. We asked them a number of different questions in regards to race, ethnicity, sexual orientation, gender. We also asked questions about if they suffered a pregnancy, miscarriage, or infant loss or stillbirth. We also asked if they had experienced discrimination in the healthcare field, as well as asking them how they felt the presentation, if it was informative, if they thought that they would be able to use this information, God forbid they were in a health crisis. So the benchmark of success. So for us, we decided that success benchmark includes at least 80% of evaluation responding, affirming that the session provided information that they thought were helpful with regarding to monitoring and advocating for their perinatal health or that of a loved one. This indicates a positive impact on participants' health literacy and self-advocacy skills. So here's some snippets from our presentation, and this is just something that I realized with Life After Two Losses. A lot of reports basically say that effective systematic change in the healthcare fields will take years or even a decade to implement. Life After Two Losses is determined to reduce the time it will take to address racial disparities and inequalities by highlighting the importance of integrating personal lived experiences and public health practices as a public health strategy. One of the things that I do with this organization is I share my story. And my story is important for a lot of different reasons. One, I think it shows those that the importance of being your own advocate, the importance of empowering yourself. I think it also, for those in the field that are working to help change this, I think it's important for us to know that we can make a difference. And a lot of times when we look at the statistics, I feel like it's very hard to like when people read the statistics, they kind of just read it off like it's okay. But when you have someone that's actually putting a face to that and explaining the things that they've gone through, I think people look at it differently. And one of the things that our organization has done with this, not only is my stories, but the stories we've collected, is we are using these stories to change the minds and hearts of politicians and those who are legislators. With doing that, then they're able to take the information that I'm giving to go ahead and make system changes and create policies that prevent these things from happening. So one of the things that we really highlight in our presentations is share your story. I noticed in our, oh, I'll get to that later, but take care of your mental health. It's very, I think we all noticed in the pandemic, a lot of us ended up struggling due to isolation, due to people getting sick, due to people passing away, but it's very important to make sure that we are taking care of our mental health. Make sure you have access to resources and support services. Seek a second opinion. If a doctor or provider is giving you, okay, this is what needs to be done, and you're unsure, you have the right to get a second opinion because maybe another doctor will feel differently. Ask questions and seek clarifications. One of the tips that I always give the people that we provide presentations is to write down your questions. Sometimes in the thick of things, when things are getting busy, you tend to forget like, oh, I had this question. And when you get home, you tend to remember it. But if you come prepared with a list of questions, you can check those off. And another important tip that I always give them that, the provider, a lot of times the providers don't have much time to spend with each patient. But if you can say to them, like, if now is not a time for you to address my concerns, when would be a good time for us to talk about these things? Because it's important, for my health. To know your rights. And again, if that's something that you struggle with, many hospitals have patient representatives and you can call on them to further understand your rights. Build a supportive network. It's very important to, like, in the, instance that something was to happen to you, it's very important to have somebody that can better advocate for you and know your wishes. And choose a supportive healthcare provider. And one of the things that I'm currently working on is finding a provider that is of color. Research has shown that providers who look like you tend to, and I'm not saying that only providers that look like you can do a better job, but research is showing that it helps. So here's some other things of the power of sharing your story. It says, sharing my story allowed me to, one, heal from my experience. It also allowed me to basically bring awareness to what's going on. I most recently did a talk at a walk against to just bring awareness, and a lady came over to me and said, "You told my story, but yet my story happened 23 years ago. I cannot believe that in this time this is still happening. We have to do something about it." In my culture, mental health was considered, I know for me, we don't really, in the Black community, we don't really talk about mental health issues. We don't, it's like a stigma to say like, oh, I went to a therapist or I got support. But it's something that's so important and we need to start doing. By sharing my story, I really hope to not scare people, but to bring awareness to it and teach people of the importance of, how to advocate for yourself. Okay, so here's some presentation highlights from our project. So our presentations are super engaging. I really enjoy, they're more kind of like laid back in a sense, and it's if anybody has a question or anybody wants to, has a comment or wants to share something, I always leave the floor open at any time for anyone to interrupt me or share. I'm very transparent and vulnerable with the participants, and I noticed that that's had a huge impact on sharing their story. HIV presentation, the crowd was a little bit rowdy a bit, but one of the ladies stood up and said, believe it or not, the information that she's giving is very important. She said, I was diagnosed with HIV many years ago, and I really wish I would have knew a lot of the things that she's sharing here today. Or in another presentation, after sharing, I had multiple losses and I had suffered from anxiety and depression. Another participant stood up and said that she lost twin babies and she had begun drinking heavily to cope with her loss because she did not have the proper avenues to be able to cope while also raising other children. Participants are leaving equipped with information, tools, and resources to better navigate healthcare systems. And newly formed partnerships. At these presentations, there are also other organizations who are doing tabling, and I've been able to, they've come over to me saying, we would love for you to be able to do a presentation at our organization, what we need to do. We've also made a partnership with the city of Newark, and that's been great as well. Okay, so here's just a few pictures, which I'll share a little bit more about, but this is a presentation that I did. This is me. The First Lady of New Jersey has come to see one of my presentations as well. And based off the work that I was doing, the city of Newark had created like a 10-point literacy program, and they had asked me to serve on their planning committee for their Cradle project. And I served as an expert panelist on the discussion on health literacy. Okay, so here's some strengths. As I mentioned, government officials have endorsed our pilot, again, which is huge because this was a pilot. We wasn't sure, if it would be successful or not. We've inspired wellness events. So based on our presentations and our partnerships, partners have decided to put on an event to bring out the community to not only receive the presentation, but to be able to go home with resources. We've been invited to serve on the City of Newark's Health Literacy Committee. We've served, as I mentioned, as an expert panelist for the Cradle Project Conference. We've served as a member of the Health Literacy Coalition, and our goal was 80%. To date, 93% of evaluations responded, affirming that the sessions provided information that will be helpful to them in monitoring and advocating for their perinatal health or that of their loved ones. So we've had some challenges. There was some funding delays, which ended up, again, we had dates set aside to work with our partners so that, ended up, we had to end up finding new partners because the new dates did not work with some of our current partners. There was some hiccups in regards to partnerships, and what we noticed was we were only doing 12 of these in the pilot, but the demand was greater than the capacity that we had. So we currently do have a waiting list for when we, run the numbers and, put our, what we could learn from it to do better next time. There was also some language barriers. While I had been fortunate enough to have the organizations provide translators at the event, I did not have the surveys evaluations in multiple languages. So it's something to, look for the next time we extend this program. So are there any questions?
Yeah, if you have any questions, please put them in the chat. So far, no questions have come through,
Okay.
but let's see if anyone might have something. I do have one. Just in terms of the, as you work in the communities, how do you maybe garner support for what you're doing and yeah, from folks who may not necessarily be, be mothers or birthing people, but or even serve them, just people in the community who care.
Of course. So I'll just give you an example. I've had people, even guys show up in my presentation and they're like, oh, this is for pregnant people. This does not involve me. And I say to them, like, do you have a mother? Do you have a sister, right? Do you have a daughter, right? I'm like, knowledge is power. And we can, if the information doesn't directly apply to you, you can provide it to someone else in your community, right? Because we are all a part of a community, right? So you can provide that information to somebody else. And every time I've said that, I've looked at the person and you can see like the gears going in their head and they're like, you know what, you're absolutely right. Because I do have this person in my life. I could give this to this person. So I think, again, even if someone shows up and the information may not directly correlate to them, I think it's powerful information that they can give to somebody who could use it, if that's what you were asking.
Yeah, thank you. Thank you very much. And we do have one question that came in the chat. Can partners or supporters take the training?
Absolutely, yes. So the training is for everyone. So you can definitely, we want you to come, right? Because again, what we noticed, right, especially with my situation, there were times where I was so bad that I didn't really know what was going on. So it's important that in the event that a pregnant person is not able to advocate for themselves, right? Because they're not well, maybe, things are going on, that a birthing person or a supportive partner could be able to take the information that they've learned here and help them better advocate for their partner or the client that they're serving. So absolutely, all is welcome.
All right, thank you. And then another a comment and question came in the chat. Says, thank you for sharing, and I'm sorry for your losses. They're in the spirit of such important advocacy. I'm working on an evidence-based practice proposal project focused on postpartum preeclampsia and low-dose aspirin. I'm curious if you've been offered low-dose aspirin as a prophylactic measure. Low-dose aspirin during pregnancy.
So yes, I was on a low dose aspirin for my last pregnancy. So I don't know if that answers your question or if you have further question from that, but yes, I did take that, but I still developed severe postpartum preeclampsia. I even also had, just another thing, I developed gestational diabetes. And for me, I felt like there was a lot of stigma. I felt like I had did something wrong. But what I learned through talking to the nutritionist was, and maternal fetal medicine, who was monitoring me very closely, I was walking 5 miles a day when my pregnancy started. They did ask me to stop because I was high risk. As I got further along, I was eating as healthy as I possibly can. And what they said sometimes is there are changes in the placenta that literally cause these effects of the gestational diabetes. And it's nothing that you can do, but you need the insulin. So again, I dealt with a lot of shame, like, oh my God, it's something I did. But once I got over that and I was able to work with my providers, we were able to get that under control with medication.
Right. Another question and comment that came in the chat. Thank you for a great presentation and thank you for sharing your personal story.
Thank you.
Um, Please forgive me if I missed it. Does your organization provide or include implicit bias trainings for healthcare staff?
So as of yet, we do not, but my story was published in NewJersey.com. And one of the things that I said I did want to work on was a training called Bringing Humanity Back into Healthcare. I believe that is so needed in this climate. I will also, in the spirit of transparency, we are currently working very hard to secure funding for the things that we are doing. We are undersourced. I am a one-woman team aside from interns. So we need more organizations and more funders to fund this great work that I'm doing. And as a Black woman and a woman of color, I noticed that a lot of times we have to prove ourselves before we get the adequate funding that we need. And, we have to do so much on so less. So I would love to be able to do that, but I need more funding. Hope that answered your question.
Hey, looks like it. Let's see, things are coming through now. It's like, I love the title, the humanity in healthcare. Okay, and then Katrina says, I appreciate this training. I had 2 children born premature. I had preeclampsia with the second pregnancy and didn't know until I went to ED and they sent me home and returned hours later. So
I'm so
thank you for
sorry.
sharing that.
I'm so sorry. Thank you for, again, I always say this in all of my presentations, and I'm getting goosebumps. It takes courage to share your story. So I'm always very grateful when people stand up and share their stories because, again, it's just confirmation of why this training and why this work is so important. And I'm glad that you're here with us.
Okay, and you have another comment. Thank you for sharing your story. Great presentation. I am a postpartum support international Spanish helpline volunteer and would love to know how we can connect moms who call with some of these resources.
Sure. So we're on all social media platforms and we have a website, which I'm not sure if the participants will receive my information after this webinar is over, but feel free to send them to our website, which is www.life after the number 2 losses.org. And there they can fill out the contact sheet and they can get in contact with us. Thank you for the referrals.
Okay, and there's another comment. Thank you so much for sharing your story, for your advocacy work, and I'm so sorry for your losses. As a L&D nurse at a major hospital right outside Philly, my heart aches for you and what you've experienced. Your perseverance and strength is truly inspirational. We have so much work to do in the maternal health space to support women of color.
Thank you.
So that
Thank
was
you
a
so
comment.
much. Thank you so much for that comment. And I will say, not all the nurses that I come in contact with treated me like that. And one incident, when a nurse came into the room and she saw me like visibly upset, she said to me, "What's wrong?" And I'm like, "I'm on bed rest to maintain my pregnancy. The staff here are not treating me well. They don't want to touch me because I'm Black. I just want lotion on my feet." I said, I like to take care of myself. And she said, "Okay." I was like, "You can put gloves on if you don't want to, touch me." And she was like, "Don't be ridiculous." She got the lotion. She put the lotion on my feet. And every time the shift change would come, I would look for her because I would hope that she was my nurse. And so much that, I left the hospital distraught, that I wasn't going to be going home with my baby. But I was so grateful that she was on call because I left my baby with her and she made such an impact. She was maybe one of the couple nurses that left such a huge impact that when I went back to that same hospital to give birth to my son, I said, I need to see if she's here. I need to see if she's here. I want her to be able to hold my living baby. And I have that picture on our social media on Instagram. So thank you. And thank you for the work that you're doing.
Wow. Okay. Yeah, you have another comment that says, thank you so much for all the work that you do.
Thank you.
All right. And We put Life After Two Losses, the link in the chat.
Thank you.
And it looks like that is all of the questions for right now. So we have just a couple of minutes. Yeah, if you want to do their call to action.
So our next is the call to action. Something that I've learned with the work that I'm doing is that I can't do this by myself. And it's important to recognize that we all play a role in improving maternal child health outcomes. The silo mentality makes impact harder to achieve. We're stronger when we join forces and work together. So with that being said, what strategies can perception and promote greater awareness among pregnant individuals about potential health risks for both themselves and their babies? And this is for you all to join in on the conversation, however you choose to do so. If you choose to unmute or to leave a comment in the chat, I would love for us to have a conversation. Did I see a comment go in the chat?
The comment says great and valuable information for our communities in this marginalized world.
Thank you. Thank you. Thank you for that comment. Did anybody have any strategies that they thought, you could implement in your community to shift the perspective and promote greater awareness among pregnant individuals about potential health risks for both themselves and their babies? Oh,
We have a comment partnering with health departments to provide health education to expecting mothers.
I think that's a great strategy.
And another comment came in, reaching community through radio, social media, and local TV stations.
Yes, again, another great comment. And I say that because we all have smartphones, right? Everyone's on their phone. Everyone's on, well, not everyone, but like people are on Facebook, on Instagram, and it's kind of like meeting the people where they are. So I think that's another great strategy as well. Do we have any other suggestions?
Well, one that it's more Hollywood, but it's interesting to see shows like I remember on Blackish there was an episode where the mother there was experiencing some discomfort in her pregnancy, and they responded right away and took her to the hospital, and there was something wrong. So that's kind of a way, through entertainment to let people know what is happening.
I think that's a great point. I don't remember right offhand what show it was, but I think for a while when I first started sharing my story, I was told by older women like, "Oh, sweetheart, people don't talk about pregnancy loss. We kind of just keep that." And that was the issue for me. Like, well, this is why I don't know what to do because no one's talking about these things, or if they are talking about pregnancy loss, it's in silos. But I saw a movie on Netflix, and it really went into the details about pregnancy loss. It even talked about like photography around taking pictures with your babies, which a lot of times people don't know that's what you can do. I know with my first daughter, they told me she could be diseased. They put her in a basin and was like, don't touch her. So I think Hollywood is a great way to bring awareness to some of these issues. I'm just looking at the chat as well. Offer education. Yes, I think that is a great, so I missed the comment. Celebrities are speaking out. Yes, celebrities are speaking out on preeclampsia, which is great. I wish there was a way that we can highlight more, like it's getting noticed when a celebrity talks about it, but what about the people in our communities that are experiencing this? I wish there was a way that we can get them noticed as well. Offer more education to medical students. I agree 100%. That's where it starts. I feel like someone did reach out to our organization and basically say that some of the old practices they were still talking about. And as far as like, oh, Black women don't feel pain. And if that's still being taught to medical students, that's a problem. This is why, doctors are dismissing Black women. So we definitely need to do more training for up and coming doctors. So someone said 2 African-American women led flourishing families to conduct similar work you're doing in New Jersey. They have their open house this evening, and I'll be sharing your story in Life After 2 Losses with the attendees. Thank you so much. Please reach out to me on our website and let me know how that went. Thank you. I see it says clinics, definitely social media, hospitals, county public health, etc. We definitely need to spread the word because families need the support. I agree. Someone said, I love that movie. So you know the movie I'm talking about. She had like apple seeds reminded her of her daughter. So she ended up at the end of the movie, her daughter was in an apple tree, which I thought was beautiful. So glad you were able to see that movie. To your point, ensuring that you are represented in healthcare space. The patients I've cared for always mention how they feel much more comfortable and care for knowing that their nurse looks like them. I 100% agree with you. We need more providers of color in maternal child health space. I agree. I think we also need to offer more incentives, right, for people of color to take this extensive training to become nursing and doctors. But that, again, that's just my opinion. Great. And then again, the other one is just what are some strategies, which I think we answer these questions, that we can implement and reduce infant and maternal mortality and improve maternal child health outcomes. And for me, the last final thought that comes to mind is no one knows your body like you do. So we have to just keep advocating and, demand that they listen to us. So I hope you all enjoyed the presentation and, was able to take something from this and the work that I'm doing and to provide it to your communities. And again, those that are working in a hospital setting, we offer grief support. So if you do have a patient that ends up having a loss, please refer them to our organization. We would love to be able to support them journey. Oh, sorry. Someone said offer workshops on how patients can advocate for themselves. Yes, that's exactly what we are doing here. So we're hoping to be able to get more funding. We are so grateful for the NML for being able to pilot this work because, again, this was a pipe dream to be able to get us started. So we're hoping that through this work, we can pitch this to other funders to be able to provide more workshops. So thank you all.
All right, thank you very much. Yes, and thank you so much, Fiona, for this wonderful presentation. Yeah, it's been great, getting good, lots of love in the chat.
Oh, thank you all so much. Thank you for your time.
And yeah, please fill out the evaluation. Veronica has put the link in the chat there.
Honest feedback, so to definitely be able to improve. Thank you.
Absolutely, absolutely. And we also have our link to the Maternal Health Week, our guide. And you have the link to UN's to Life After 2 Losses.
And then I'll put my website, my email address in the chat if anybody wants to connect or want to partner.
That sounds good.
Thank you all.
Well, all right. Well, thank you very much. And UN, will we be able to share slides with the participants?
We can if need be, that's fine.
Okay. Okay, great. All right. Well, thank you all very much. And thank you, UN, again, for a wonderful presentation. And everyone have a wonderful rest of your week. And, go out there and work for Black Maternal Health Week. Thank you. Bye.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.